wanted to continue our series this week on natural solutions to emotional disturbances. You know, we're making this kind of emotional disturbance awareness month, and this program is really about the whole gamut of emotional disturbances: anxiety, depression, ADD, ADHD, bipolar disorder, and I mean I could go on and on. But what we're discussing for our purposes is we're grouping all of these problems into one category. Modern medicine kind of looks at them as all different things. In other words, anxiety is different than depression is different than ADD. But for our purposes, we're going to group these into one category called emotional disturbances. And so from a holistic natural wellness model, it's not as important exactly which label has been put on the brain dysfunction as it is just to state that there's obviously something not working correctly in there. And so we would want to do things to improve the brain dysfunction through various means, regardless of what label has been put on it. So the program today and over the next few shows, and then of course we're following that up with a community class on this, is on what we call emotional disturbances or neurobiological disorders. Now, these are relatively new in society, at least from a perspective of how common they are. This was something rarely seen 40 or 50 years ago. You almost never heard of these things. Now, I would be willing to bet that everyone listening knows someone who suffers with emotional disturbance or mood disorder, whether it be anxiety, depression, whatever you call it.
Now, Dr. Kevin, is it natural for people to go through, a sadness, but that's different than an emotional disturbance? How do you...
It is normal. Mm-hmm. We've made it not normal, but yeah, I mean, it is normal to where if you have something bad happen or, you have some sort of tragedy, of course you're going to go through this, grieving, sad process. All that's normal. Mm-hmm. I think the unexplained sadness is the key to this. But the question is, why has this changed? What's changed in the last 40 years? And I personally think that if we can figure out what has changed over the last 40 years so that almost everyone you talk to suffers some kind of an emotional disturbance, if we can answer that, then we can begin to build a solution that will solve these problems. So the big question is, what's different now that wasn't around 40 or 50 years ago? And I personally don't buy into the, it's genetic. My mom had anxiety and I have anxiety. I don't really buy full-fledged into that theory because genetics don't really work that way. So in other words, you're telling me that in one generation, everyone's genetic structure has all of a sudden mutated at the same time over just 40 years to give so many people emotional disturbances that are now passed down to their children? Genetics really don't work that way. Genetic changes take generations and generations to slowly evolve, and it wouldn't be all the same thing. So I don't really think that's right. I think that if your mother had it and you had it, I think that it's more of a coincidence than it is purely a genetic problem. Now, there is some genetic component to it, but the question is how those genes are expressed. Things in our environment cause our genetic structure to either be expressed or turned off. So that's where we really can look. Genetics don't suddenly just change over a whole country in one generation for no reason. And so it makes much more sense to me that something has changed in our surroundings. Something has changed in our lifestyles, in our environment, in our everyday world that is causing these new disorders. And the truth is, I have a pile of research on my desk right now to prove that I'm right about this, that there is something that has changed in our surroundings that's causing this. And we're going to get into that later, but just know that real discoveries have been made on why these things are occurring, and real breakthroughs and natural treatments for these conditions have really, it's become something special. But before we get started, I wanted to go back to last week and clarify a few things. CJ asked me, well, are you saying that you can cure these things? And I wanted to just touch base on that again because, the very real truth is, as more of a wellness holistic practitioner, we really don't feel like that we accept patients to cure anything. In other words, I don't accept patients to cure any condition, no matter what it is. Treating conditions is people being sort of stuck in that Western American kind of model of healthcare. The truth is, treating symptoms have never cured anyone of anything. And so over the last 18 years, Now, I've actually helped almost, I think, 10,000 patients with all sorts of problems, but I only accepted them because I found an underlying dysfunction within their body that was probably causing them to feel that symptom. And now when you eliminate the underlying dysfunctions, the symptom no longer has a reason to exist. Symptoms are your body's way of telling you something is wrong, and whenever you go inside the body and try to work on what's wrong, the symptoms no longer have a reason to exist. So, we're getting into it now. This is real healthcare. This is what healthcare should be.
Popping a pill, go to the doctor and I got this ache. Here's a pill, take it. That's really just putting duct tape on it.
Exactly right. Yeah. And so I accept patients to treat the body and the brain dysfunctions using totally natural means. So number one is stop thinking in terms of, can you treat my anxiety? Can you treat my depression? Patients come in and they'll tell me that. So I accept patients to treat their body, not their condition. So when they come in and go, Doc, can you treat my anxiety, or can you treat my depression? Can you treat my headaches? I say, no, I'm going to treat you. Your headaches don't need the treatment. You do. And so it's just a different way of thinking. You're the one with the problem, not your symptom. But this is a very hard concept for people to grasp because we've been ingrained since we were babies to take this, it'll make you feel better. Oh, you feel bad? Come here, take this, it's going to help you. So we are literally imprinted on our brains with the idea that my problem is my symptom, and I must take something to cover up that symptom, and when I do and I don't feel it, now I'm okay again. That's imprinted on our brain from the time we're little bitty babies. And this is one reason why America consumes 50% of the pharmaceutical drugs on planet Earth, and we are only 3% of the world's population. We have more doctors and hospitals than any other country in the world, and we spend more on health care than most of the developed world combined, yet China and Cambodia have a longer life expectancy than we do in the good old United States of America. And this is why.
It's sad, isn't it?
So let's move on from this old way of thinking. Let's get to the underlying cause. Let's get into the brain and body malfunction and find out where the malfunction is, what is causing it, and let's target that. Let's try something new and different and get a better result. So, that's what healthcare should be. Not this sort of, patch it up and hope that it goes away type thing. So stay tuned. We're going to have more to come after the break.
It's